Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss few important questions from evaluation and management for your 2025 CPC exam. So they have asked multiple concepts. As you all know, ENM comes with different major departments like outpatient services, IP services, IP consultation, OP consultation, and preventive medicines, emergency department, critical care, okay, and neonatal care, and also home or residence, and then skilled nursing facility. So there are many multiple important concepts are there. Okay, so as of now for this video, I have taken some 3 to 4 questions which are very important, and the concept I will discuss. So the first concept or a question we have is regarding preventive medicine. So 15-year-old is seen by his primary care physician for an annual exam. His last exam with the primary care physician was 2 years ago. He has no complaints. Okay, so here what you have to understand, the patient came for physical, that is annual exam, and he has no complaints. That means he has no abnormalities. Also, they have mentioned his last exam with the primary care physician was 2 years ago. Okay, so 2 years ago. Here, the preventive medicine includes, so let's just, the preventive medicine includes both. You need to first identify whether the patient is new patient, okay, or established patient. And again, you should also check the patient age criteria. So in our question, they did not mention whether patient is new or established, but they are giving a key that he was, his last exam with the primary care physician was 2 years ago. So by seeing this statement, you should consider this patient is new or established. Okay, so since they have documented 2 years ago, this patient belongs to established. Okay, he is already like, let's, many will think this patient is new, but let me show you with the, resource, right? So we'll see the new and established patient eligibility criteria, and then we'll discuss the question. So you can see here how to determine the patient status as new or established. So if you see here for new patient, a new patient is the one who has not received any professional service from the physician or other qualified healthcare professional or another physician, from the exact same specialty and subspecialty, who belongs to the same group practice within the past 3 years. Okay, within the past 3 years, if the patient did not take any service, okay, then also he will be considered as new patient. This is the second eligibility criteria for new patient. The first one, as you all know, if patient is completely new to the clinic or facility, he will be considered as new patient. And next point is, he came to the clinic, but he gave the 3 years gap. Okay, if he met that 3-year gap, again we will conclude him as a new patient. And then established patient means the established patient is one who has received a professional service from the same, exact subspecialty, or who belongs to the same practices within the past 3 years. So within the past 3 years, if patient takes any kind of treatment, it could be 2.5 years, or it could be 2.8 years, or 1 year. Okay, 1.5 year. So all these years will fall within 3. So within 3 means the patient will be considered as an established patient. Okay, so seeing that patient is established here, the other thing you have to check is patient age. Okay, 15 year. So let's check established patient and 15-year age criteria. So go to preventive services, and you can also see for new patient, we consider it as an, the first thing is initial comprehensive preventive medicine. For established, we take it as periodic comprehensive preventive medicine. Like once we initiate annual exam, the further treatments or further year annual exam will be considered as periodic comprehensive preventive medicine. Okay, so let's check the age. So you can see age here. We have question with 15 years. So for 15 years, 99394. Okay, 99394 is adolescent, age 12 through 17 years. So from 12 to 17, if you get any time or year in between, you should select 99394. Okay, 99394 is for established patient, and further you can also see like the codes change based on patient age. So 99397 is 65-year or older. The meaning of this is if you get beyond 65, okay, like if you are getting 75-year-old patient or 80-year, all those you can use 99397. If patient is new and patient age is more than 65, you can use 99387. Okay, so the new patient codes, the range is 9938 and established code range is 9939. Okay, and with the preventive medicine, ICD usage is very important. Okay, so you know with the preventive codes, that is general wellness codes, we use Z series first listed ICD codes. Okay, G series first listed ICD code, we take it. But these G series codes have the age criteria. Okay, we have to check the patient age. Accordingly, we have to assign our ICD codes. Okay, whether we have to first check any abnormalities are there or not, and then we have to assign the ICDs. Okay, for example, so in our question, patient age is 15. Okay, so 15 code is 99394. So for this, what will be the ICD code? So see here, he has mentioned, like the doctor has said, he has no complaints. He has no complaints, nothing but he has no abnormalities. Okay, so if we find no abnormalities, then we have to assign a code. So you can see for 12 to established patient, 12 to 17 years criteria, we use these codes. Z00121 is for encounter for routine child health examination with abnormal findings, and G00129 encounter for routine child health examination without abnormal findings. So in our question, we did not find any abnormality. So we have to select Z00129 as our ICD code. Okay, so in our question, ICD is not given, but in case if the question report both CPT and ICD, and if you have options, then this coding point you should be aware. Okay, based on that, you can easily select the correct ICD code. Okay, and same way, if patient age is above 18, okay, above 18, again you check patient is having with abnormality or without abnormality, then code these two. G0000 is encounter for general adult medical examination without abnormal findings, and then with abnormal finding is G0001. Okay, these are the codes. And also for child, also we have separate codes, like health examination under 8 days, one code, and under 8 to 28 days, one code. Okay, these are the extra knowledge that you should be aware, so that if they ask anything extra, you will be able to give the correct answer. Okay, so for this, correct answer is option D, 99394. Okay, so if in the CPC exam, if you get this question, as you can see, the question is very short here, but this question will be little 3 to 4 lines will be there. So please make sure you read thoroughly, and I have explained the concept also. If they are questioning about new patient, select new patient code. If they are talking about established, select established patient codes. Okay, check the patient age criteria. Okay, that's all for preventive medicine. And with the preventive medicine, if say for example here, a patient came for annual exam. Okay, when patient came for annual exam, if physician identifies any kind of acute problems, any kind of acute problems, that acute problem will be treated separately. Okay, so for that we need to build separate ENM codes. Okay, majority, like if patient is seen in ENM OP setting or office setting, and he came for general wellness. With the general wellness, physician also identifies maybe skin lesion, or maybe patient is having abdominal pain, fever, anything which is acute, and that needs to be treated separately. So we have to code the ENM codes also. Okay, so if I get a question with this, like say for example they are treating some new patient, or okay, patient is established, right? So low MDM, overall ENM treatment also provided. So for low MDM, what will the code 99213 you will get? Okay, so 99213 you need to assign with this code 99213, and here the major very important coding guideline is we need to use 25 modifier. 25 modifier must and should you need to assign with 99213. Whatever the ENM OP codes will be there, for that we have to use 25 modifier, not with the preventive codes. Okay, we have all the coding guidelines, so you can just go and refer this one, and here under to this you can just check the coding guidelines. Okay, modifier 25 should be added to the office or outpatient code to indicate the significant or separately identifiable evaluation and management services provided the same day with the preventive medicine service. Okay, like this, we have to be aware about the coding guidelines. And one more guideline we have, that if patient is taking general wellness with vaccination, okay, that immunization codes we will assign, and then also we may use 25 modifier. Okay, so these are all very important things, so you need to be aware. So next, second question we have is regarding 16-year-old female just moved to the new area and is living in a campground with her parents. She has a several medical condition, and parents are unable to take her to the physician office. A physician sees the patient in the campground and documents medical decision making of moderate complexity. Developed comprehensive treatment plan. So the total time they have given for MDM only, leave it. Developed comprehensive treatment plan. So whenever they are saying, so again here also you need to identify what is the place of service, like where she is taking treatment is important to determine what ENM category codes you have to take. Okay, that is the first thing. Second thing is, again you need to find out whether this patient is new or established. Okay, and lastly, what is the MDM level? And here, when they document both time and MDM, the documentation which supports for medical decision making, and also they are giving time documentation. That time, cross check between following two guidelines. Check according to time what is the code you will get, and for according to MDM guideline what is the code you will get. Okay, so when you compare between two guidelines, whichever the guideline is giving you higher reimbursement for the particular scenario, that code you should code it. Okay, that guideline you have to follow. So in our question I removed the time. So in our question they gave time also and MDM moderate complexity also. But if you take time guideline, time was giving lower level, that is level 3 it was giving. Okay, so you don't need that because you're already getting one level higher by following MDM coding guideline. Okay, so that you should be knowing. And then here what are the key terms? So first we'll find where she has seen. Okay, living in the campground, and physician sees the patient in the campground. Okay, campground, this is not office setting. Okay, this is not outpatient setting visit. The patient is in the campground and physician is going and seeing in the campground. So what department it will come, we have to check. And then like she moved to the new area and developed a comprehensive treatment plan. So these two keys are enough to conclude that patient is new patient. Okay, because she's newly moved to some other area. Okay, then she will be totally new to that area, and also developed a comprehensive treatment plan. So this is the keyword where whenever the physician sees the patient at the first time, they'll usually document they have developed a comprehensive treatment plan. Like comprehensive treatment plan requires more time. Okay, so this is like a one keyword, but it is not like it is not necessarily you have to take it. But since she has moved to new area, you can consider this is a new patient. Okay, and did not anywhere they did not give any keywords to consider this patient is established. Okay, so the two keywords we got, the patient is new and also campground is the place of visit. So you can see the options. We have options 9934 series and office visit. So office visit you can easily eliminate because the patient is in campground and physician treated her in campground. So the office visit is not required. And then one is 99349 is an established patient. This is also we don't need it. Okay, so let's see the answer. So this particular thing falls in home or residence visit. Okay, home or residence visit. So you can also check the coding guideline for this home or residence visit. So you can see following codes are used to report the evaluation and management service provided in home or residence. Home may be defined as a private residence, temporary lodging, or short-term accommodations like hotel, campground, hostel, and cruise ship. Okay, so we have campground. So this is a home or residence service. Okay, so I have already told you patient is new patient. So let's check the new patient codes. 99341 straightforward medical decision making, 342 low level medical decision making, 344 it's a moderate level of medical decision making. Okay, so easy. Our answer is 99344. Okay, 99344. Option D is the correct answer. Okay, and you can see here option B and C has 99417. This is an additional like an add-on code for prolonged service. Okay, if you meet beyond the high level ENM, further if you meet additional 15 minutes, you can take this prolonged service course, but these options are incorrect. Okay, so if you want to give 99417 for home and residence means you can check the higher level. 99345 gives higher level of medical decision making. And when selecting the total time, okay, so 99417 will come only when you are using time coding guideline. Okay, so when using total time of the date of encounter code selection, 75 minutes must be met or exceed. Okay, and if you meet 90 minutes or longer, okay, 75 plus 15, the meaning. So if you get an additional 90 minutes or longer, so not 75 plus 15, sorry. So 75 minutes must be met or exceed. So for service 90 minutes or longer, C is prolonged code 99417. Okay, so when you meet more than 90 minutes, so we take 99417 as our, I see the additional CPT code. Okay, additional ENM 99417. It carries, as you all know, 15 minutes per 1 unit. 1 unit, 15 minutes it will give you. So already I have explained clearly 99417 in the past videos when I did ENM series. So please go and check if you have any doubt on 99417 or 99418. Okay. So same way, if the patient is established, so home or residence visit, you can see for service 75 minutes or longer, see the prolonged service code 99417. So from consider, if you get from 60 minutes, additional if you get 15 minutes, okay, 60 plus 15, you will get 75. So when you get this scenario, you are supposed to use 99350 with 99417, okay, as an add-on code. Okay, this is how it works. And then, so coming back to, yeah, so second question answer is D. And next question, a new patient presents to primary care office with a complaint of recurrent headache that are worsening in severity, and appropriate history exams are documented. Final diagnosis is migraine, and initiation of prophylactic prescription drug management is given. Suspecting the cause of recurrent headache, a head CT scan is ordered. Result yet to come. Physician also document the total time is 30 minutes with the patient for this visit. So as you can see here, we have MDM components also, like MDM elements. You could actually check what is the problem addressed and what is the data level and what is the risk level. Okay, all three MDM elements are supporting here, and also they have documented total time. So total time is 30 minutes, and easy here, new patient. So new patient they only given, and also primary care office. This is a office setting. Okay, so office setting codes are this one. Okay, office visit or other outpatient. So patient is new patient. So for new patient, 30 minutes must be met or exceed. So 30 to 44 minutes, your level will be 99203. Okay, so according to time, you will get 99203. So let's find out according to MDM what we will be getting. So read the question here. So normally, so MDM requires two elements, okay, which must be met or exceed. So first, let's find out all the three elements. What is problem addressed, what is data, and what is risk. Like this, we can find out. So let's focus on problem addressed level. So first, problem addressed level, chart A. Let's see what level we will get. Okay. So read the question again. New patient presents to the primary care office with a complaint of recurrent headache that are worsening in severity. Okay, so recurrent headache, it's a repeated headache that are worsening in severity. So you need to, highlight it. And then the final diagnosis is migraine. Okay, so only if you have the final diagnosis as a migraine, you can take your problem chart A as low. Okay, you can just consider it as an acute uncomplicated illness. Okay, so only if they diagnose final, like it's an usual migraine means, you can just take it as a low level, concluding it as an acute uncomplicated illness. How they will document? They'll document migraine, and they have started that prophylactic medicine, and also they'll not mention anything needs to be diagnosed. Okay, so in our question, if you see further, after initiating the prophylactic prescription drug management, they have added a line suspecting the cause of recurrent headache. So they need to know what is the exact cause for the headache, and the head CT scan is ordered. Result yet to come. So one test is ordered, diagnostic is ordered, that is CT scan. So here, migraine is not an ultimate medical condition for the patient. Okay, so after CT scan, what results will come, that is important. So here CT scan result is pending. Okay, so based on this like the statement, you have to check what is your problem now. So the problem level actually falls in this one. Okay, one undiagnosed new problem with uncertain prognosis. Okay, so here one condition is being undiagnosed. So it could be after CT, they could document, intracranial hemorrhage, or maybe anything related to brain, like brain tumor, and many other like the brain related medical conditions are there, right? Like inflammation, meningitis, or maybe aneurysm. So there are many and hydrocephalus, many conditions will be there. Okay, so these are like symptoms. Okay, migraine is like, if it worsen, then it could lead to further damage. Okay, so if CT scan was ordered earlier and then they have given final diagnosis as a migraine, then you take it as the level, problem address level is low. But here they have concluded migraine initially, further and they are suspecting something and then they are ordering CT. Okay, so as the results are pending, we should always go with an undiagnosed problem. Okay, so that is important. So considering that, problem will be moderate, and prophylactic prescription drug management is given, risk is also moderate. Okay, so total final MDM is moderate. Final MDM is moderate. Final MDM is moderate means your level is 99204. Okay, so as I mentioned earlier, so both guidelines are supporting here. Based on time, you are getting 99203. Based on MDM, you are getting 99204. So here you should remember, we should always go with a higher reimbursement. So we will select 99204 as our answer. Okay, so for this question, 99204 is the answer. Okay, so but if the same question, only time coding guideline, if they ask what is the evaluation and management code, if we follow time, then for 30 minutes your level will be 99203. Okay, and also if CT scan is not ordered, or if results like not yet to come, if it is not documented, then for only migraine and the prescription drug management, according to MDM coding guideline also, you would have got 99203 as your level. Okay, so it is important to know each and every chart and how these medical conditions they are documenting. Okay, based on all that, the severity wise, we can take it as an MDM moderate. Okay, so that's all for third question. So check what question you will get in exam, and any further addition, deletions are there in question. Based on that, I have explained the concept. Based on that, you can select your answer. So next question, 25-year-old comes into doctor's office with a complaint of his big toe with a pain, swelling. Physician examined the toe and it is an ingrown toenail that has caused the painful blister. The blister has popped its own and discharging pus. Okay, the prescription of Keflex 500 mg is given to be filled at the pharmacy. What is the level of MDM element for risk of complications and or morbidity and mortality of patients management? So see here, the question is regarding, they're not asking final MDM, they're asking the level of risk, that is chart C. Okay, what is chart C? You can see MDM element of risk of complication. So chart C is risk of complication, morbidity, mortality of patient management. They need only this chart level, not the final MDM level. Okay, so easy. They have ordered Keflex 500 mg, that is prescription drug management. Okay, so your risk level is moderate. So you also, that's why you always refer the complete question. So answer is C, moderate. Okay. So next question, a new patient in group home is seen by group homes physician for coughing and shortness of breath. Patient has a history of asthma on the exam is wheezing and lung function test performed. Patient is given treatment of albuterol. The physician calls the prescription for prednisone, and physician assessment is acute asthma with exacerbation. Okay, so easy. It's again group home. So home or residence ENM category codes. Okay, and 99305, 304, these two codes are belong to nursing facility. Okay, so nursing facility here, it is not about the nursing facility because patient is not seen in and he's not even admitted. So totally it is a home physician. So home or residence ENM codes you need to select. So 99342 and 344. Option B and D you need to cross check. So easy. Patient is having asthma, history of asthma, and also acute asthma exacerbation. Okay, so acute asthma exacerbation and albuterol both falls in like moderate condition. Okay, albuterol is a risk is moderate and asthma is again moderate. Okay, acute asthma exacerbation. So what the thing is, they have given ICD codes. So 99342 J4541 they have given, and option D 99344 J45901 they have given. Okay, so J45. Okay, before ICD, let's find the CPT. C 99342 and 344 what it is. So home or residence, new patient 99342 is 30 minutes time, and the time we don't have. MDM is low MDM. Okay, and 344 is 99344 is moderate. Okay, this is a moderate MDM. And if you check J45901, unspecified asthma with acute exacerbation, and one more J4541, J4541, you can see it is moderate asthma actually. Moderate persistent asthma with acute exacerbation. So since they did not mention any detail about moderate asthma, we will consider it as an unspecified asthma. Okay, and also easily as we have discussed, our MDM is giving level 4. So option D is correct. Okay, option D is correct, not option B. So I think that's all. So next question we have regarding 2-year boy brought into the ED in cardiac arrest emergency. Okay, see, 75 minutes with critically ill patient. So patient age is 2 years, and for 2-year patient they are performing 75 minutes of critical care. So as you all know, less than 30 minutes of critical care, we don't code it as a critical care course. But for 2-year-old baby, so if patient is shift to NICU, we have that age category, right? Initial and subsequent treatment for neonate, pediatric. Okay, up to 5 years, we have a separate course. Okay, so that course we need to check, and also inclusive services along with critical care and NICU services we have to check. So by checking that, you will understand which CPTs are already included with the procedure and which CPTs are not included. Okay, so this question I'll leave it for you guys. So just refer both critical care and NICU, this 99471 description. Check the inclusive services and check what are the services they have performed along with the procedure. Okay, along with the critical care, and you can give your answer in the comment. Okay, so that's all for today. I have explained all the questions very clearly. So if you can appreciate, you can leave the comment. If not, it's okay. So yes, so these are few important questions. If you want to learn ENM, MDM, and the other specialty properly, I mean ENM departments, you can join the classes. Okay, so yes, that's all for today, and thank you for watching. Please do share my YouTube channel with your medical coding friends. So it will help them all. No, it will help them. And yeah, thank you so much.